Hello and welcome to the fourth video of our series looking at our osteoporosis EMR tools for Telus PS Suite. This video will be focusing on reminders, specifically looking at reminders for when patients are due for bone densities, for blood work, and for other components of their osteoporosis care. Okay, so we'll show you so again, we've uploaded these reminders as part of video 1, so if you haven't already done that, you may want to go back and upload those. Once they're uploaded, what you can do is you go to Patient, Reminder Report, and I'll show you these reminders here. So there's a couple of them here that focus on when they're due for their next bone density. Okay, so if we look at here, this reminder is a low-risk reminder looking at patients who've had a FRAX documented in their chart, whose last FRAX value was less than 10, and their last bone density was over 10 years ago. Now, you can decide on your own preferences for frequency of bone densities for both low, moderate, and high-risk patients. So whether you use 5 years or 10 years, again, you can decide on that, and you would just, if you want, you can always, in the edit reminders window over here, you could go in and change that. I'll actually show you how to do that right now. If you go to edit reminders. So let's say you don't like 120 and you want to use 60 instead. You double click it. And over here, you would just simply put in 60 instead of 120. And you would click OK. And again, you would have that option. So again, this captures the low-risk follow-up patients. And in their chart, it'll say needs BMD. Okay, I'll go back to the reminder report here. So again, it'll say in their chart needs BMD, but you can also run that report. So let's say I want to run that report for all my patients to find everyone with a FRAX less than 10 who are overdue for a bone density. I'll simply click only my name, click reminders down here, and then that'll run that reminder and give me a list of all those patients. Okay, so again, puts it in their chart, and runs the report. Okay, same thing for moderate risk. So if their last FRAX was between 10 and 20, and it's been 5 years since their last bone density, it'll say needs BMD in their chart, and we can run a report on those patients. All right. This is a one for high-risk patients. So anyone who has had osteoporosis in their chart, so they've been labeled as having osteoporosis. It's been over 3 years since their last bone density, and they're not on Prolia. Rationale for that is if they're on Prolia, many of us, and from many endocrinologists as well, we're not really changing treatment on these patients once they're on Prolia. So whether you do a bone density or not is up to your discretion. Again, you can modify that if you'd like, but again, so high-risk patients every 3 years. Okay, there's a few other ones in here that I'd like to show you that again would have been uploaded in video 1. So if a patient of yours has never had a bone density, and they've never had if they've had a bone density done, and you've never put a FRAX in their chart, and they're not osteoporotic, it'll put in their chart the words calculate FRAX. So this is a trigger to you when you see this, that the patient's had a bone density, but you've not documented a FRAX in their chart ever. So again, 2 ways you can run that list, or simply when you see the patient and you see that in their chart, you can go in and calculate a FRAX using the custom vital convention that we discussed in video 2. Okay, and again, just a reminder where those reminders will pop up in a patient's chart on the left hand, well, depending on how you have your layout, of course, but you'll see this big long list of stuff that sometimes you have. And this is a fake patient, so it has an unusually large list. But in here, it'll say needs BMD if they don't meet the criteria. Okay, in one of these reminders over here. Going back to the reminder report, just a few other things that we'll be tracking. So we went over the ones related to bone densities. the people who are due for who need a frax calculated. There's one here about height. So if they have osteoporosis and you've not documented a height in the 12 months, it'll say in their chart needs height done. Rationale for this is to find patients who potentially have had compression fractures. And the last thing here is osteoporosis blood work. So if you have a patient who you've labeled as having osteoporosis by coding them in the problem list, and they've either never had a vitamin D level, or a calcium level, or a creatinine level, or an alkaline phosphatase level, or a TSH or hemoglobin, so if any of those have never been done, it'll say in their chart needs osteoporosis blood work completed. Now, it won't tell you which one they're due for. Our system's not sophisticated enough for that, but you can go into their chart and find out which one they're due for. Okay, so again, that'll be in their chart, in the reminders, but you can also print off a list of all those patients who are due. All right, so that's it for the reminders related to bone densities and other osteoporosis follow-up. Video number 5 will be up next, where we will be reviewing Prolia and a reminder you can use to find your patients overdue for Prolia. Thanks.